Hello and welcome to Health, Wealth and Happiness. I am your host Dr. Sadiq. Today we'll be discussing diabetes. We have Amy Munro here today with us. She has been practicing as a physician assistant in Western New York medical practice for past 5-6 years, and today she is going to be giving us some tips or advice on diabetes. Welcome, Amy Munro.
Thank you.
Thank you for coming here today with us.
Yes. Thank you.
So tell us, our audience, what is diabetes? Why the diabetes is so bad disease? Tell us something about it.
So diabetes is very prevalent, especially in the United States. It's a disease of the pancreas. Your pancreas produces a hormone called insulin, and if we don't have enough of it or if it doesn't work properly, our blood sugars go very high. So, and you need to control your blood sugar.
So pancreas is very important. Pancreas is a gland which is just behind our stomach, and that works, that's very important. Pancreas produce insulin, and as Amy said, that insulin is very important for us. So if we don't have enough insulin, we get diabetes.
Correct.
What are the type of diabetes mellitus?
Well, there's type 1, which usually occurs in younger children, young adults, and that's where your pancreas doesn't produce insulin at all or very, very little. That type of diabetes requires insulin shots. The other type of diabetes is type 2, and that's what most of America has. It's due to being overweight, having a bad diet. There's a lot of family history in it as well. If mom and dad, grandma, grandpa have it, you have a higher chance of developing it.
I think that type 1, you said that insulin comes very important. We don't have much insulin in type 1. And type 1 is mostly in younger people. And as Amy said, that insulin is not enough for us to actually fight our carbohydrates, our sugar. And we have huge sugar in our system. And if we have a lot of sugar in our system, that's a problem. And the type 2 is when it develops later on in the life, and the obesity is a number one factor, right?
Absolutely.
As you said, stress is very important. Stress is a very, very important cause of diabetes. I think everybody should know how to handle the stress. We'll do a separate program on stress. Tell us something about that. Pregnant women also are more prone to have diabetes?
Yeah, I mean, they do definitely check for it. Your body's under different stresses. You gained weight. There's less insulin sensitivity when you're pregnant. So unfortunately, if you develop diabetes when you're pregnant, you do have almost a 50% chance of developing it later on in life. So it is something to ask for in primary care. If you find out that somebody did have diabetes while they were pregnant, it's something to look for, even in young adults.
Oh, so it means that pregnant women are at risk of getting diabetes because they gain weight, and again the weight is an important factor in diabetes mellitus.
Absolutely.
And weight, actually, if we are overweight, it reduces, as I'm repeating it, it reduces the insulin sensitivity.
Correct.
So that's very, very important. What are the risk factors we should inform our patients or our people around us that they should watch?
Well, the biggest thing, like I said, there's family history, there's ethnicity. Unfortunately, African American population, the Asian population, Native American, they do have an increased risk of developing diabetes. Your obesity and lifestyle, that's the one we can control. If you eat too many sugars or eat a poor diet and you gain a lot of weight and don't exercise, your risk is much higher.
I think people think that once they get the diabetes, they will have diabetes forever, but that is not the case, right?
Right. I mean, I do tell my patients, you're diagnosed a diabetic because you had all the symptoms and the elevated hemoglobin A1C, but we can control it, and you don't have to have the consequences of the diabetes long term. So with medication, with diet, with exercise, we can definitely manage diabetes.
So what would be the symptoms of diabetes?
Well, most people will come in, some people won't have any symptoms. We'll just do a finger stick or we'll do a random draw and they'll have an elevation. But people will come in having increased thirst, increased urination, They may have an unplanned weight loss. They'll come in. I had a patient who came in with a 60-pound weight loss. He was so excited from his last visit, and he was unintentional, didn't try. And we did a finger stick, and he was over 350. Oh. So unfortunately, his was due to diabetes. So
was he heavy?
Yeah, I mean, he started off at 290. So
290 pounds.
He needed to lose weight, but I don't like my patients to lose it that way.
So if a person is obese and they lose 10 to 20 pounds,
it makes a huge impact on your insulin sensitivity if you lose weight. But if you're losing weight unintentionally, we don't know you're diabetic, it's got to put up a red flag.
So what Amy just said, I'm going to again stress on that, how important it is to lose weight. If you only lose 10 to 20 pounds, it can impact huge on your blood sugar. What happened that if you have too much sugar in your system, it starts pouring through the kidney, and you start losing protein, you start losing the important parts of your diet which you needed, like proteins, and that's where you lose weight. If unintentional weight loss, that's not good. Right. I'll tell you my own story. I lost one time like only 10-15 pounds, and I started worrying about that, why I lost weight. I'm eating the same. So I quickly checked my sugar, and I checked my urine. It was not pouring any sugar in the urine, so I was fine. I was happy. Right. Because diabetes is something which you don't want to have it. What other things people should worry about if they are any other symptoms which they should be worried? You said fatigue. You said they should an unintentional weight loss.
Yep. I mean, they can be irritable. There can be fatigue. There can be depression. There's so many other symptoms. When you have that, I describe it as molasses in people's blood versus a nice thin blood, that people don't feel well. They're tired. They have, don't want to go to work. They don't want to get up, and it makes a huge impact in their life overall, their job, their family. It's very impactful.
Even I think they get itchiness, and they get, I think they also can affect their vision.
Oh, yes,
and also
get blurred vision.
Also, sometimes people will start having increased urination. That also is one of the alarming signs. If you're going to the bathroom very frequently, please go to your doctor. That's very, very important. If you have a plan with your doctor, if you're overweight, that is a very important thing. Yep. What are the best food to eat before and after exercising? Because I know exercising is very important to lose weight. What would you suggest that? What are the good foods?
So even though this is a diagnosis of sugar, of too much sugar, you still need carbohydrates. You still need energy. So having more of a complex carbohydrate or a fruit prior to exercise, and protein is very important. We don't get enough protein in our diets, and so having a combination of the two will help them have enough energy to do the exercise and then to recover afterwards.
So it means people will ask me, should we stop eating carbohydrates altogether?
No.
That's not the case, right?
You can't, yes.
We have to eat some of the carbohydrate, but we have to count our calories, right? Calorie count may be the best way
Calorie count, carb counting.
Yes.
Looking at what food you're putting in your body. I tell my patients all the time, we get this great book from one of the drug companies that it tells you how many servings you can eat per carb. And I ask them, how many servings do you think is in a bagel? Just toast. And it's 1/4 of a bagel is a serving, and you can only have 7 carb servings in a day. And people don't realize that. I mean, that's a lot of carbohydrates that you're putting in your body, and they didn't know.
So if you want to have a bagel, you can have it, but then that will be, you'll be done for the whole day. It's up to you how you want to do it. Yeah. What should be, I know we talked about that some of the symptoms which are alarming, which you should watch if you are overweight. Also, what would be the fasting blood sugar? What is fasting blood sugar?
So fasting blood sugar in somebody who does not have a problem with their sugar is under 100, somewhere between 80 and 100. People that have diabetes, we try to keep them under 120. And then after they eat or they're postprandials, we want to keep them under like 140, 160.
Okay.
So, but if you find somebody that's above, I mean, the old way of looking at it is 126. Two readings above 126 is diabetes. Now we really do look at the hemoglobin A1C more than we look at the fasting. But under 100 is where we want to keep it.
So if you have a kind of a suspicion that you might have diabetes, so you go to your doctors, ask the doctor, can you get the fasting blood sugar? If that's quick, they will just prick the finger, they will click right away. And then you can just, as Amy said, 100 or 100, around 100, we should have it.
Yep.
How can we cure diabetes?
We can't cure it, unfortunately.
But we do something. We can do something.
Manage it.
Okay.
We can manage it, and they can live a normal lifestyle and not have the consequences of the diabetes.
Stay tuned. We'll discuss further on this one because this is very, very important. We'll take a break here. Welcome back. We'll continue our question to Amy. Can we cure diabetes?
Unfortunately, we cannot cure it, but we can manage it through diet, exercise, medications. So people can live normal lives without any problem.
But if they are really in the beginning phase of diabetes, they call it pre-diabetic. So in that case, I would say we still have a chance to, actually I would not use the word of cure, but we really can control it very well.
And not develop it, yes.
Not develop it real. So
Absolutely.
pre-diabetic patients are very, very important. That's a very crucial stage because once you have a full-blown diabetes, that's very, very difficult to control. In the beginning, we can actually help them a lot.
Absolutely.
So I think once a person gets diabetes, tell us that how we can help them to accept that diagnosis because it's very, very
it is very difficult. Patients think that it's ruined their lives. They can never have ice cream again. They can never have birthday cake again. And I explain to them this is a process. I recommend diabetic education. We give them resources from the office. I tell them to go through their pantry and look at anything that has refined sugar. If there's more than 2 grams of sugar in something, take it out. You don't need those things. Learn. Educate yourself because if you don't understand the disease, you'll never accept it. Get family to support you. Yeah. Most likely there's somebody in their family, unfortunately, that has it, and they can kind of have a support.
It is so common. It is. We can control. We can actually help ourselves. Weight is very important. I'm going to again stress on the weight. Weight is very, very important, and your stress level. You have to bring these stresses down in life, and that can help in diabetes. Do the patients have to go all the time on insulin, or there are oral medications too?
Absolutely. There's a lot of oral medicines, and we certainly start. Most people go on metformin, which people that are pre-diabetic or just insulin resistant, it really helps with that resistance. So many people go on metformin even if they are not diabetic. And there's so many classes of drugs now that are orals before we have to go to insulin or any kind of injectable.
I just recently have one of my uncle who had diabetes for a long time, and he was not he doesn't control on his intake of sugar, and he is obese. So I end up putting I took him to the specialist, and we end up putting him on the insulin. He was so scared and afraid. He was literally crying. I said, I don't want to be on the shots. I said, you have to then you could have done that a few years ago.
Right.
On your weight, on your diet intake, and the exercise. So 3 tips for the audience. One is you look at what you eat, number 1. Number 2, if you go to your doctor and ask them what other options of medications they have. Insulin is the last resort, right?
Absolutely.
Especially for the type 2 diabetes.
Yep.
So if they have to go on insulin, sometimes we don't have a choice.
That is
if they are not controlled with the oral medications, then they have to go on insulin, right?
Yep, and all type 1s need insulin. So sometimes we don't have an option, but we do choose our basal insulins, which are once a day insulins. So they don't need to pull out a pen with every meal. And once patients realize it's not intrusive, it's not painful, they do become more comfortable with it. The story I get all the time is, I can't go on insulin because my grandma died from it. I said, what do you mean your grandma died from insulin? This happens many times. Well, as soon as she started insulin, she died. Well, she didn't die from insulin. She died because she didn't control her diabetes for all those years. And once they realize they get control, their sugars come down, they feel better, they're fine with it.
Actually, I tell patients that, insulin is, if they are taking insulin, if their blood sugar is not controlled, insulin is the best option because it's very close to your body.
Right.
Your body produces insulin, and we are giving insulin from outside. So it's very, very close to what nature has created for us through pancreas. So I think oral medicines does have a lot of side effects too. So if your sugars are uncontrolled and you actually cannot do anything else, talk to your doctor, talk to the specialist, and controlling diabetes is very, very important.
I have also had people that come in and their sugars are so high that I do need to initiate insulin right away because we need control. But then they change their diet, they lose 60 pounds, they are exercising, and their sugars are so low, we get them off their insulin and on orals. So being on insulin is not always lifelong if they change their lifestyle. That's if I could stress that the most. Weight loss, exercise, and diet, it's so important.
This is so important point which Amy just told you, that in the beginning, if you have a very high blood sugar, go on insulin for short time, and then we can taper you down.
Absolutely.
Talk to your doctor. That's very, very important. It's a very common disease these days, so we have to, if we pick at early age, if we start treating at early age, that's very, very helpful.
Yep.
So if the patient is on these medications and they start running low sugar, that's also very dangerous. So what are the symptoms of low sugar?
So low sugar, and I do tell my patients this all the time, I really would rather them run a little high than run too low. Running too low, they'll get a little bit dizzy, lightheaded, irritable, but unfortunately, if they're running extremely low, they could lose consciousness. They could be driving, they could be, fall and break a hip. The consequences of running too low are very dangerous.
How often you would suggest your patient to check your insulin, your blood
So it
sugar?
certainly depends on the patient. If they're not on any kind of injectable, any kind of insulin, sometimes it's only once a day, or if they're stable, a couple times a week. But if they're injecting themselves, if they're just injecting with a one-night dose, then maybe it's only in the morning. But if they're mealtime, it's got to be before every meal. So it really depends, but if they're not stable, they're checking sometimes 6 times a day. So it really depends.
So we have to tell the audience that it depends when you should, how many times you should be checking your sugar, and talk to your doctor again.
Absolutely, yeah.
Can they be on the pills and insulin together?
Yes. Yes.
So that is also a possibility.
Absolutely. We really try, as we talked, to avoid the insulin at the beginning if we don't need it. There's so many good pills that work on so many of the defects now that we can get away without using insulin early on. But if insulin's needed, they can still stay on some of the pills. Some of them we take off because they're not needed anymore. But they can be on both.
I think what happened is, like as we discussed in the beginning, that there is type 1 where we don't have the insulin. That is one type. But the type 2, we do have some insulin, but that is either not effective or that is not enough for us.
Right.
So we kind of a supplement from outside. We sometimes give medication to make that insulin more effective.
Absolutely.
So I think the time comes if we work again on weight. That's very important. We can make our whatever insulin we have little bit in our system, we can make it very effective if we have a weight under control.
Right.
What would be what type of fruits and vegetables you would tell people that they are good for us?
So fruits and vegetables are really important. The ones that are higher in fiber are obviously better. I recommend apples and berries and things like that. When you get into your watermelons and your
I
oranges,
love watermelon.
They're just higher in sugar, but honestly, any fruit is better than having a piece of bread or a candy bar. So if that's going to be your patient's snack, that's okay with me.
So the snacks should be the fruits and vegetables, even watermelon.
If they really want it. I did have a patient recently tell me she was having half a watermelon a day.
Oh my God.
And her sugar was high. I'm like, maybe we want to cut back a little.
I love watermelon.
Yeah.
So your snacks can be with the apples are very important, you said, and they're very
high
good.
in fiber and easily digested. So. Yeah.
That's really good. Some of the patients ask me, can we drink alcohol? So what would you suggest them?
So I think that everybody can have some alcohol, but it's in moderation. And in my opinion, and what I tell my patients, if they want to have a glass of wine at a holiday or at a dinner party, it's a glass of wine. It's not 3, 4, or 5. A lot of the medications can interact with the alcohol. So definitely discuss it with your doctor because everybody's on different drugs.
Yes.
You have other medical problems. But a glass of wine, 4 ounces, not a glass, I think for most people is acceptable.
Yeah, I think you sometimes they have other problems in which alcohol is not allowed, or sometimes they have liver problems. So
definitely discuss it with your doctor individually.
Yeah. So what would, if I'm traveling, what would you, God forbid, I'm not diabetic, but what would you advise to our audience, what type of snacks they can carry when they are traveling? And they are diabetic.
Any diabetic really needs to be educated on eating frequently, whether they're traveling or not. Even if they're in their work, they should have little snack packs of about 100 calories that they'll eat every 2 to 3 hours, and that's in between their meals. And they're things like a cheese stick or raw almonds, raw walnuts. You do want to get away from anything processed. But your apple, about 100 calories though, of healthy proteins and healthy fruits and vegetables, carrots, things like that.
Carrots are very good. I would add something to it, which is it's a very traditional in East that we use in the management of diabetes, bitter melon. They call it bitter melon. It's actually a vegetable, and it's really bitter. And that actually you can get on the Oriental stores, and they actually we kind of a little bit saute in oil, and little oil, not much, and put some salt and pepper. That's a treatment of diabetes. It's done by, it's on the on internet you can find out on web that bitter melon is very actually people managing, they crush it and they drink it as a water with water. That also can bring down our sugar. So I think for the audience, we'll talk more about diabetes in our next program, what other problems people face. But for today, thank you so much for watching Health, Wealth and Happiness. We hope that you enjoy the program.